Hello, everyone. Welcome to our briefing on the novel coronavirus and its impact to health and travel safety. Our first speaker is Courtney Kansler. Courtney is a senior health intelligence analyst at WorldAware. She joined WorldAware during the height of the 2014 West Africa Ebola outbreak. She has background in combat-related traumatic brain injuries in U.S. veterans and also works as a licensed emergency medical technician in U.S. fire departments. She has also applied her expertise overseas in Zimbabwe and Guatemala. Courtney is going to provide an overview of what we understand so far about the novel coronavirus and the possible health risks to consider. Courtney?
Thanks, Mary. So here's what we know so far about this novel coronavirus. Like all coronaviruses, this began with a zoonotic, that is animal to human disease transmission, most likely in a seafood and or wildlife market, wet market in Wuhan. The ongoing outbreak is, of course, widespread in China, but is primarily confined to Hubei province. The number of cases officially coming out of China is likely underreported, but again, the increase in cases that we've seen in recent days, the number of confirmed cases recently, that is not necessarily indicative of an explosion in disease activity, but rather they're getting better at disease surveillance and testing, and the results of those laboratory tests are coming in, and therefore they're reporting them. What they do know so far in preliminary tests of small clusters of these cases is that people who are infected with this disease are contagious during the incubation period, that is, before they start displaying symptoms. The incubation period is up to 2 weeks, but is usually 3 to 7 days before symptoms appear. This illness is primarily a mild flu-like illness in most people. It'll present with fever, fatigue, cough, in some cases diarrhea, which then may also worsen to pneumonia and in some cases kidney failure. Most people who are getting sick, and definitely most people who are dying of this disease, are primarily among older adults with chronic medical conditions, that is, such as diabetes, emphysema, COPD, and also very small infants and children. There has been, according to the media, there has been limited human-to-human transmission in cases imported to other countries throughout the globe. This has primarily occurred in family clusters. So if a person comes back after having left China, then spends time with their family, they fall ill, it then turns out that they then have their family tested and they are also symptomatic. Our interpretation of this situation, as I said earlier, the surge in cases we've seen in the last few days is due to improved disease surveillance and detection, but of course that also creates the media frenzy. It's important to tamp down on the level of panic that often ensues with these sorts of situations. Again, it's a glorified flu in a sense. Seasonal influenza remains a much larger threat and still kills more people globally every year than this has so far in a month. The WHO, or the World Health Organization, met a few days ago to discuss whether this incident met the qualifications of a public health emergency of international concern. The most recent outbreak that they considered to be a public health emergency of international concern is the Ebola outbreak that is still occurring in northeastern Democratic Republic of Congo. Well, they did meet and they decided that while this is certainly an emergency for China, it does not yet meet the qualifications to be a global emergency or a public health emergency of international concern. We have had some clients ask, if this will be a problem for their supply chain in terms of health risks. We've had some clients ask whether, if we send something from our warehouse in China to somewhere in South America or in Europe, do they have to incinerate the package upon arrival, or am I infecting people at the destination from the packages that I'm sending? The answer to that is no. Again, in terms of if people have assets or clients in China that remain in China, always report illnesses as soon as it is suspected. Self-isolation is very important, and do not take fever-reducing medication to avoid transportation health screenings in airports or rail or bus lines, etc., because it's important to to not mask those because imported cases around the globe have occurred when people have decided to do so. That concludes what I have today from my health intelligence perspective. Back to you, Mary.
Thank you, Courtney. Today we have a special guest speaker, Dr. Geoff Tothill from International Medical Group. Geoff is the Chief Medical Officer at IMG. His specialty is aviation and travel medicine. Dr. Tothill's early career included work in emergency medicine with a special interest in trauma management. He also worked with the UK's humanitarian operation in Sierra Leone during the 2013 Ebola outbreak in West Africa. Dr. Tothill is going to discuss prevention tips for the workplace and travelers. Thanks for joining us today.
Thank you for the introduction, Mary. Yeah, as you say, I've been asked to discuss protection measures. I'd just like to start by reiterating something that Courtney said. The press have built this up and sensationalized it somewhat. It is a significant outbreak. We are beginning to see a rise in cases in line with a transmission ratio or reproductive ratio of the virus, which is the reproductive ratio is the number of people that each carrier of the virus will infect during the course of their illness. We think that's about 1 to 2 to 1 to 2.5 people. So, and we're seeing rise in the number of cases in China in line with that sort of transmission ratio. So, you know, China has taken some really dramatic and positive steps to slow the spread of the virus within China. Some of that's been successful in slowing the spread, but there are areas where there are significant numbers of cases across China, of course. So all of the protective measures are really aimed at people who are either in those endemic areas or traveling through those endemic areas or hubs close to those areas. At the moment, as Courtney was saying, there's no evidence of sustained human-to-human spread outside China, which is important because if you're walking down, you know, the road in Tokyo or somewhere where there have been cases reported, you're extremely unlikely at the moment to come into contact with anybody that's got the virus. So, but clearly, if you are, you know, in an affected area in China, you need to take some sensible sort of basic precautions, and basic steps do protect you well against this virus, actually. So, good hand washing. At the time of the avian flu outbreak pandemic, WHO published some good advice on thorough hand washing. Normal soap and water will kill this virus as long as the hand washing is thorough and done in the correct way. Where soap and water isn't available, alcohol is also effective, which should be used just on the hands and just above the wrists. The reason why hands are important is that one of the most important ways that you can contract this virus is by having the virus on your hands and touching your mouth or your eyes. As humans, we touch our mouth or eyes hundreds of times a day, in fact, unconsciously. And every time you do that, if you have virus on your hands, you run the risk of giving yourself enough virus particles to get the disease. And that's the other reason why the WHO started a campaign to get people to capture their sneezes, usually in the crook of the arm, rather than on your hands, although tissues work okay. But the whole aim of that is to again, reduce the number of viral particles that are spread in droplets, and also reduce the number of virus particles on your hands, because again, we interact with hard surfaces on our mouths with our hands. Social distancing is important. If you're traveling through these areas, try and spend as little time as possible in areas where people congregate, in terminal buildings. In fact, people say in the press that it's easy to catch on aircraft, but in fact, aircraft are remarkably clean because of HEPA filtration, and the air conditioning systems on aircraft destroy viruses, even down to the size of coronaviruses. So you're actually more likely to catch this virus in the airport terminals or riding on the bus or the train to go to the airport. So taking those precautions is useful. And lastly, mask use I want to touch on because it's somewhat controversial. In the Far East, there is a culture of wearing masks to protect yourself from these sorts of diseases. And in fact, lots of people wear them even when there aren't disease outbreaks. And so when there is an outbreak of viral disease, most people you will see out in public will be wearing masks. Clearly, that's not required outside China. And there is some doubt about how much a mask protects you. They have to be the right sort of masks. They have to be changed regularly. And actually, masks are of the sort that are widely used are relatively ineffective in preventing the inhalation of airborne viral particles. But what they do is they remind the wearer every time they move their hands to their mouth or their eyes, they feel the mask, and masks tend to reduce the amount of hand-mouth contact. And that's probably how they reduce the spread of disease most effectively. So wearing a mask of itself probably doesn't help, but the reduction in touching your mouth and eyes does. So moving on to corporate protection, if companies have contact centers or have operations in the affected areas, there are some simple steps they can take. Clearly, increased use of webinars and remote working is important. So try and reduce the number of face-to-face meetings, and understanding by staff that if they do get unwell, they should as Courtney was saying, they should self-isolate until they are asymptomatic at the end of the viral infection. Social distancing is important. Handshaking should be discouraged. And the other thing that can be done sometimes is shifts can be split, where you need workforce to undertake roles, but they can be divided into separate groups that can be distanced from one another. That will sometimes help as well. And of course, we've talked about remote working. Discouraging congregation, water cooler conversations, gathering for meals, widespread use of alcohol, and a published strategy with good signage. You know, when do I use the alcohol? How do I use it? And discouraging people from, for example, visiting each other's work areas. And when people do, to wipe the hard surfaces down with a hard surface disinfectant. All of those things can help prevent the spread. But you know, just to, again, before I close, to reinforce Courtney's message, which is seasonal flu is far more of a risk at the moment than this epidemic. Up to 20,000 people in the US have died from seasonal flu since October of last year, and so for most countries, that's far more of an important health threat. The problem, if this becomes pandemic, of course, is that the health burden from this disease outbreak will be overlaid on top of the normal seasonal flu volumes. So, you know, keeping personally protected will help both yourself and your company, but also reduce the burden on the local healthcare system. And that's what I have for you today. Thank you.
Thank you, Dr. Tothill. Next, we'll be hearing from Brendan O'Reilly. Brendan has spent most of his adult life living and working in China, India, and New Zealand. His main areas of expertise are China's foreign policy and its domestic socio-political dynamics. Brendan is going to discuss how the Chinese government has responded so far and what scenarios you may want to monitor.
Thank you, Mary. Obviously, most people operating in China right now, their main concern from this virus are the health risks posed by the virus itself. However, the Chinese government has been very proactive in implementing protocols to stop the spread of the virus, and these restrictions have also caused secondary disruptions, especially in Hubei province, but also in locations throughout the country. Most notably, from January 23rd, authorities stopped all outbound travel from Wuhan and adjacent cities in Hubei province. In addition to those extreme movement restrictions in Hubei, there have been other measures throughout the country. Many tourist sites, such as Shanghai Disneyland, the Forbidden City in Beijing, have been closed in order to prevent large groups of people from gathering in certain areas. Also, many Chinese New Year celebratory events were canceled. There have been some ground transportation restrictions imposed in parts of China outside of Hubei province, specifically cancellations of some long distance bus services and some train services in Beijing, Tianjin, Hebei, Shandong, Jiangsu province, Shanghai, and parts of southern Henan province. Additionally, authorities have set up health screenings in numerous areas. These are specifically like body temperature screenings at areas like college campuses, airports, and train stations. Obviously, these screenings are going to cause some travel delays as people need to get through these screenings. Chinese authorities have also extended the official Chinese New Year holiday period for 3 days to February 2nd. And local authorities in numerous provinces and cities throughout the country have indefinitely delayed the reopening of schools. And they've also imposed many business restrictions and work from home policies for non-essential industries. Going forward, there are some scenarios to monitor in which we might see these disruptions becoming more severe. It's possible that authorities will impose more transport restrictions in additional areas of China. It's also possible that authorities will further extend the official holiday period or otherwise extend restrictions on non-essential industries. Something to note here is that traditionally in China, around the Chinese New Year, most industries outside of retail and travel do basically shut down for about 1 to 2 weeks regardless. So as of now, these restrictions on business activity haven't caused major economic or supply chain disruptions. However, if these measures are prolonged into, say, around mid-February or beyond, we could see some rather severe economic impacts, certainly in many industries in China, and potentially affecting global businesses that operate in China, sell things to China, or buy things from China. Another inflection point that we are continuing to monitor would be tighter internet controls. Obviously, there is censorship in China, there is some control of information. However, we haven't seen authorities imposing blanket bans on internet usage in any areas. So for example, in Wuhan right now, people can use the internet as they normally could. Something to monitor going forward would be the potential for civil unrest in some areas. Specifically, if business operations are disrupted for a long time, potentially if there are some shortages of essential goods in any areas, we could see a situation in which there are protests and other mass movements in some areas. Again, we haven't seen this yet, but it's certainly something that we should continue to monitor as a potential development. Something to keep in mind here is going forward, these developments are largely going to depend on the severity and geographic range of the outbreak itself, along with the political and economic imperatives of Chinese authorities.
Thanks, Brendan. Our final presenter is Tony Roccaforte, Senior Security Advisor from WorldAware's Global Assistance and Response Team. Tony previously worked as a Senior Intelligence Analyst focused on political violence and armed conflict, and is also a veteran of the U.S. Army Special Forces. Tony is going to discuss WorldAware recommendations and preparedness tips for organizations in the region. Tony?
Thanks, Mary. I'm going to shift gears a bit. As my fellow panelists have already said, it is important to keep this in perspective in light of some of the sensationalized media coverage. And I do not want to come across as alarmist, but we have seen some unprecedented security measures taken here, particularly in Wuhan and neighboring areas, in an effort to contain the virus. So I want to discuss some basic incident management and planning considerations in the event some of these enhanced security measures are implemented elsewhere. First, obviously, clients need to ensure they're staying informed of any significant developments, liaising with WorldAware through the Access to Analyst program, monitoring all their internal message traffic, and communicating regularly with local contacts to ensure they have the most up-to-date information on the ground. Make sure you're up to date on the locations of the latest outbreaks, areas under quarantine, any major service disruptions, travel restrictions, curfews, etc. We also want to brace for an increased security posture in the region. If confronted by security forces for whatever reason, make sure your people are complying with all instructions immediately. Do not attempt to bypass any security cordon or security checkpoint for any reason. As mentioned previously, consider implementing a work from home policy as well. So ensure your people have remote access capability, redundant communications, as well as backup power supplies. And then personnel in the region should also register with their embassy in or diplomatic mission in the region if they haven't already done so. However, ensure that your organizations are developing plans, incident management plans, evacuation plans, shelter-in-place plans, etc., that don't require government or diplomatic assistance. I'll touch on more about that in a minute. And also, have your people in the region pack a go bag so they're ready to move at a moment's notice. The slide here outlines a suggested packing list, so I'm not going to belabor the point in the interest of time. Start getting your communications plan in order as well. Build out some redundancy into your plan and ensure you have a no comms plan in place that includes mechanisms for face-to-face wellness checks in the event electronic communications, as Brendan alluded to, could become disabled or ineffective for whatever reason. The implied task there is to ensure that you know where your people are located, know exactly where they are, have a very detailed itinerary that's up to date. Don't rely on an itinerary that was submitted 6 months ago. Confirm that your people are still where they said they would be. Next, I'm going to cover some very high-level evacuation and shelter-in-place planning considerations. When developing evacuation plans, we want to try to ensure the evacuation is done as gracefully and as economically as possible. Ideally, we want to take a phased approach to any evacuation. So when we draft plans, we aim to draft plans with specific indicators and triggers and clear instructions for all impacted personnel during every phase. When drafting the evac plan, we need to make sure that we have clear personnel accountability procedures, hence the importance of the robust communications plan I mentioned earlier. You want to keep your vehicles prepped and staged at all times, fully fueled, equipped with all the emergency equipment, your spare tire and jack, fire suppression equipment, comms, trauma kit, water, etc. Ensure multiple assembly areas and evacuation points are identified, mapped, and validated as viable safe havens, and make sure everyone in your organization is briefed on the location of those sites. Make sure you also have enough vehicles and trained drivers to transport anyone and everyone within your organization and their essential belongings to those assembly areas and, if need be, those evacuation points. Redundancy is important here as well. You know, if one vehicle in your convoy breaks down, do you have a contingency plan in place to crossload personnel and their luggage, or are all your vehicles already overloaded? Just, you know, some things to consider when you're drafting these plans out. We also need to identify any areas of potential congestion. We're looking at potential choke points, security cordons, obviously the quarantine areas. We're going to need to have alternate routes around these locations, with the understanding that security forces may close down main roads or restrict access to airports or other transportation hubs on short notice. So it's absolutely essential that we have these alternate routes planned out ahead of time, and obviously enough fuel in our vehicles to drive those routes if need be. And finally, covering a few shelter-in-place considerations now. When putting together shelter-in-place plans, we want to ensure that we have at least a 10-day supply of potable water, ideally 1 gallon of drinking water per person per day, as well as high energy, shelf stable foods, ideally 1,500 to 3,000 calories worth per person per day. We also need to ensure that we have adequate toiletries, personal hygiene items for all impacted personnel. We need medical supplies, trauma kits, AEDs, as well as people who are trained to use that kind of gear. If people are taking prescription meds, we also need to have a plan in place to ensure that they have a steady supply of those prescriptions in the event the shelter in place extends for a prolonged period of time. Again, redundancy is key here. So like we did for comms, and transportation, we want to make sure we have backup plans for water, food, medical, and fuel resupply if you're planning to shelter in place. Regardless of the course of action taken, continuous analysis, timely decision making, and prior planning are absolutely essential here. WorldAware can assist organizations with analysis as well as drafting and testing and implementing plans and procedures, but ultimately each organization is responsible for deciding on their own course of action. And on a final note, I touched on this earlier, organizations should be careful to avoid relying too heavily on diplomatic missions overseas to secure your people in these types of situations. Unless your organization is working directly in support of the government, there is no guarantee that their diplomatic missions overseas are going to be able to provide any kind of direct support to your organization. So the bottom line there is make sure you have plans in place that are not dependent on government assistance. And with that, I'm going to wrap up. Thanks for your time. Back to you, Mary.
Thanks, Tony. On behalf of WorldAware and our presenters, thank you for joining us and have a great rest of your day.